All right, everyone. Thank you for being here tonight at Town Hall 5 as we celebrate some of our COCA members who have already had in-person successes in early 2022. So just as a reminder, if you can just put your first name and your camp name, and then if you can turn on your camera, we love that face-to-face interaction. And if you have any questions, please put them in the chat. We do have 15 minutes scheduled for the end to answer any of your questions. So next week we have Flashes of Hope on Tuesday. Then May 25th, Kids Kicking Cancer is coming to teach us a little bit about adding therapeutic martial arts to your programs. On May 31st, we have our final town hall of the season, and it's Dr. Rafi and Dr. Dubé coming to give us a COVID-19 update. And then we're pausing till August and getting ready for camp. So I'm very proud to be joined tonight by our esteemed panel. So first we have Jamie from Camp Sunshine, Georgia, and we also have Edith, who will be in the chat explaining a little bit about the programs that she's run for Camp Sunshine as well. Brandon from Camp in Texas, and Jennifer Benton from Mak-A-Dream in Montana. So without further ado, we'll jump right into the questions here. So if we can go around to the panel, if you can tell us what programs you've already offered in 2021, or sorry, in 2022, and if you offered any in-person programs in 2021, or if you just kind of reopened this year. So we'll go first to Jamie.
Hi, everybody. Jamie Ekstrom, and we did 2 family camps this weekend, or 2 family camp weekends in April. And then Edith, who's here too, she ran a teen retreat in March. So that's what we've been able to do this year. We did do a virtual sibling camp as well, but we'll focus more on the in-person ones that we did.
Go to Brandon.
Okay. So I always find that I should give the disclaimer that at Camp we serve multiple populations, not just cancer, because most of the COCA camps are fairly focused on children with cancer. So when I talk about our programs, we are serving people with a lot of different types of disabilities or medical conditions. But we have been doing in-person weekend camps for just the campers. We have been doing family weekend retreats for the whole families. We did 2 spring break camp sessions for just the campers, and also a parents' night out program, one night a month for 2 or 3 of the months so far this year, and a teen and adult day adventure program. So we've been doing a lot of in-person programming this year, and had also run summer camp in person last year, as well as a lot of family weekend retreats throughout the pandemic. So. I think, Jennifer, it's you.
All right, we all start with our caveats. We did do in-person programs starting last fall. We did a family camp, and those folks were the only ones of everyone I'll mention that actually drove to Camp Mak-A-Dream. So that was all Montana families, and that was in August. And then we did a fall retreat for women from all over the country in September of 2021. We were going to do a partner caregiver retreat in late October of 2021 that we ended up canceling because of Delta. We were going to do a family camp in February of this year. We also canceled that, but we did go back and do a spring caregivers in April, just not even 2 weeks ago. And we have another camp in person on Thursday of next week starting, but people fly here for all of those. So we're a little unique in that fact.
Excellent. All right. Thank you. So this next question I'll break up into 2 chunks so that we don't have to overload our brains with a long question. So what policies did you use to host the programs in 2022? So for the first chunk of that question, let's focus on, did you require a vaccine? And what was your masking policy, if any, for 2022? Let's start with Brandon.
All right. So I can tell you that for our campers with cancer, as well as any of the other conditions that were listed in the CDC's exclusionary guidelines, such as Down syndrome, severe asthma, extreme obesity, any of those, we did require vaccinations in 2021 for any participation. As we get ready to enter summer 2022, we have said that vaccinations are now available for all of those populations. We do have a number of parents who actively choose not to vaccinate. And in Texas, we have state laws that make it very difficult for us to require vaccinations. And so we are accepting at their own risk, essentially, even for those populations on the exclusionary, and making it clear that there are risks involved, but that families are assuming those risks. We had been requiring testing before every program, PCR tests, and then if for some reason someone couldn't get a PCR test, or they were showing some symptoms of something, doing rapid tests on site when they got there, even if they had a PCR test already. During the height of Omicron, we were requiring rapid tests on site for everyone, period. We've relaxed that a little bit because our community transmission rates are in the low to mild area. And so we have reduced the necessity of having the PCR tests, but we're still doing, having both the PCR and the rapid, but we are still requiring some testing prior to programs. We are also, since things have become much lower in the transmission rates, we have not been requiring masking during programs. We first started relaxing that for our family retreats, where everybody who came to camp was staying on camp. We continued for a while longer, having masks required during check-in and check-out, so that people who were coming, who were not part of the community that would be staying at camp, were protecting against, whatever spread. We have decided that going forward for summer 2022, that if the campers have been riding in the car with the parents without a mask, even if the parents are not staying beyond check-in, the campers are, and they've been exposed to the same things as the parent, and wearing masks is not going to make a big change during that check-in process. We're still doing a lot of social distancing during check-in. We're still not allowing parents into the cabins at all. They go to the cabins directly for check-in, and then everything is done outside and with minimal people around at each assigned check-in time. So we're still doing a lot of those distancing things. We also decided that for summer 2022, that we're not going to keep the tight cohorts for each half tribe, but we are considering all of camp a cohort. And so we're kind of bubbling all of camp. So I don't know if all of that made sense. It's a whole lot that goes into that one question.
Yeah, perfect. Thank you, Brandon. And Jennifer, you next.
Yeah, so we, for 2022, are requiring negative PCR tests prior to coming to camp, knowing that, of course, then people could potentially be exposed on their way here. But once they get here, we can't just simply send them home in a car. So we are requiring that. So we are also doing indoor masking, not outdoor. So indoor masking outside of your cohort, and we too have expanded the size of our cohorts. So each cabin is now going to be a cohort. Last year we were doing half of a cabin was a cohort and had to stay together. So now we're doing a whole cabin cohort, including their volunteers in that cabin. So when they're unmasked, they can be unmasked with their cohorts. So while they're eating and while they're in their cabins, they don't have to mask, but anywhere else on campus, anytime they're mixing with other cohorts indoors, we're going to mask, and outdoors, we're going to distance. Is our plan.
Awesome. And Jamie.
All right, so for ours, we actually had two different policies. So for family camp, it was a little bit different than what we did for teen retreat. And Edith already put what we did for teen retreat down in the chat. But for family camp, we did not require vaccination for the family because they were acting as cohorts, and then we had everything distanced. But we did require the PCR, same as everybody else, within 72 hours. So one of the barriers that we ran into with the PCR test in Georgia is that certain counties or certain areas in the state were starting to charge, $200+ for the PCR test, which was making camp not accessible to a lot of our families. So for those families that ran into that barrier, they were able to test at camp. So everyone was tested, but the majority were PCR, a handful were rapid on site. And then sorry, go ahead. You're on mute, sorry.
Sorry, go ahead and finish, Jamie. I just didn't address the vaccine issue.
And then for teen retreat, for our campers, they were cohorting in their cabins with 2 cabins. We did require vaccination, 2 doses, and then it was booster for active treatment, Edith. And then 2 doses for all of our volunteers. And then in the summer, it's going to be booster for all volunteers and camper. Yes. And then we did masking for family camp, was anytime indoors, and we did anytime outdoors within 6 feet of another cohort or another family or our staff. So we kind of had that. You can be walking around camp with your family, no mask. Once you get into another family space, masking. And then for teen retreat, it was masking all the time except in the cabin or eating. And then Jennifer, if you want to go back.
Yeah, and I don't have much to add on the vaccine front because, like Brandon mentioned, in Texas, we too have laws in Montana that not only won't let us require vaccination, we can't even require that people tell us their vaccination status. And if we happen to know that or they offer it voluntarily, we can't use it as a criteria for selection or inclusion in our program. So extra layer of complication there. We're strongly encouraging vaccinations, and thankfully, a lot of people are kind of offering that up, but if they choose not to tell us, we assume they are not vaccinated and are extra careful.
So Brandon touched on a great subject of arrival procedures. So we'd love to hear, Jamie and Jennifer, did you change your arrival procedures at all this year compared to a normal year, maybe 2019? Let's go with Jamie first.
Edith will be able to answer for teen retreat better than I can answer. So yeah, they stayed in the car, and that's probably going to be a long-standing tradition now of not letting parents to the cabins. I think for everybody. I actually started at Camp Sunshine last year, so I've only done COVID protocols for them. Based on how it used to, we basically just added the screening at the gate with making sure that they turned in their testing, and then once they've done that, everybody's masked, and we kind of do a phase to their cabin, but it's pretty similar to what they used to do.
We haven't changed anything yet with our check-in because we've had smaller groups and they've been adult age groups. So no parent issues of dropping off kids or anything. But since we're masking indoors anyway, we've had them masked and just kind of, filtered through. And it being a smaller group, it's been a nice thing. For summer, we may very well just move check-in outdoors as long as weather allows for that. And we've cut our capacity some. So we're just not going to have quite as many folks.
Great, and this wasn't on the prep sheet, so if they don't seem prepared, that's my fault. But one of the questions that I always get from a bunch of COCA members, who kind of is in charge of your COVID-19 policies? So for example, everybody's requiring PCR tests. Do you take those in before the kids arrive? Do they do it on arrival? And who's kind of like your quote unquote COVID liaison and in charge of making these procedures? So let's go with Jennifer first.
I would say we've got kind of a layered approach. It depends on if it's decision-making or execution of things. And so we have a medical committee and our medical director, and now we have an on-staff physician as well. And so they, along with myself and my co-director, have kind of made those decisions on what our protocols would be. And then we have a camper manager who helps execute, like we're doing pre-screening of everybody that they have to upload daily screening questions and upload their negative PCR test results. And so she's helping us, manage that prior to camp. And we're not testing upon arrival because we can't turn around and send them home. So it wouldn't really buy us much to do that.
Jamie?
So our medical director is kind of the final say. And then what we've done with her is as we've gone deeper into COVID, our team kind of is able to take the policies that we started with and edit them a little bit as kind of things have changed. And then we keep submitting those to her and we get the thumbs up. And once we get that thumbs up, that's the policy that we go with. And then if things like with the family camp where PCR tests were not being available, we would kind of run up, we need to make an adjustment for these families, and those adjustments are approved. And then as far as at camp, the families have, well, for summer it's going to be a little bit different, but for the weekends, they would submit their PCR. They had the opportunity to submit the PCRs as soon as they got access to them to me. So I'd have that running list. But if they had it in hand, we do the nurses who were that kind of gatekeeper at the front would kind of collect those last few if we hadn't received them, and then if they didn't have any of it, they would test them right then and there, just so everybody had a check mark next to them.
Sort of similar on many of those things for us. We have a committee that's made up of our medical director, another physician who's on our board, our head nurse who is a nurse practitioner and a camper mom, and then our CEO, myself as chief program officer and executive camp director, our chief administration officer, and our camp director. That's kind of been our committee who's making all these policy decisions. A lot of the paperwork, when we can, we've been collecting in advance through our family support program, who essentially are camp registrars. They're the ones that do all the paperwork with the campers and families to get them to camp. So they will collect some of that information in advance when it's available, but otherwise we collect it at the gate when they get here. One of the things that we implemented before last summer, it first went along with our summer theme, which was the 2021 Summer Music Festival. And so we created an all access pass that basically goes through all of the screening questions that you need to ask for COVID exposure, loss of taste or smell, fever of over 100 degrees, all of those questions. And so we have it in a questionnaire format that they complete at home. within 24 hours of arrival at camp. And it generates an all access pass for them that they can show on their phone. And that speeds things up at the gate. If they don't have that, then we just go through all the screening questions with them. But the all access pass has been a good way to speed some of that paperwork up. We still do temperature checks and all of that stuff at the gate for everybody. One new thing that really just came to light today for us, and I don't know if anyone else has run into this, but insurance has been covering PCR tests, and it's not now. The law that was in place or whatever apparently has sunset, and insurance companies do not have to pay for PCR tests anymore. And so our committee is now reevaluating if we are going to just plan to do rapids at check-in for everybody, period, or if we are going to find some other way to do PCR tests. So that's a big question that came up for us today, because we have a weekend camp coming up this weekend, and those of us who run programs and get tested every week before running programs, we're trying to schedule our PCR tests, and it's like, nope, you're not eligible unless you want to pay out of pocket, $135 or whatever. And so we're having to look at that to see if we're going to need to change our policies and accept rapid tests. And we are thinking right now that if we do accept rapid tests, we're probably just going to administer them ourselves on site, because there's too much ambiguity otherwise. So adds another layer of logistics.
Yeah, Brandon, at Happiness Camping, we're doing the same thing for the same reasons you just said. We're doing rapid testing ourselves and cutting the testing company out this year. So this question and the answers are going to be completely subjective, but I'm sure a lot of people's heads are spinning with what policies to implement this year. So just in your opinion, and we know that it takes a layered approach to be successful, but what's the single most important policy that you enacted that you think led to your success? Is it vaccination, masking, cohorting, pre-arrival testing? If you had to pick one to really focus on, and what would that one be? So let's go with Brandon first.
All right. I would have to say that the one most important thing for us has been testing. We have caught a few people, staff, volunteers. One weekend, it was our two cooks who came in the same car. And so I was cooking and other people were cooking that week because we sent them right back home. So testing has really been the thing that has prevented us from allowing COVID into camp. Having operated in person last summer, having been operating these programs really since the fall of, or I guess spring of 2020 is when we started doing the family retreats. And we have had 0 cases of COVID actually at camp, except those that we caught and sent away immediately. So we've had no spread. So, for us, that says something's working. And we're, going to definitely keep on with the testing.
That's great. Let's go to Jamie.
I'm a little bit split. I'm with Brandon on testing. I think that's what makes me breathe easiest when I'm going to camp. As far as like knowing it's most likely not entering the gate. However, I'd say my second almost as high or just as high is our cohorting, and just making sure the families are potted and having reduced interaction, and as much as I don't want that to happen, but I feel more confident that if anything did get in, it would be minimal spread.
Sure. And Jennifer.
Yeah, it's hard since we can't even factor vaccines in, really. I think I'm probably going to say masking, because regardless of, even though we have cohorts, which I think have been great, as long as we've been masking, then mixing of cohorts is a little less concerning. So for now, for us, for our situation, probably masking. I'm sorry to see it go on transportation, honestly.
So I know David on the call would really appreciate that. Everybody just covered all of the MPIs to show that they're all very important. So Brandon already touched on it a little bit, but are there any policies that you plan on changing based on your experience of the programs you've already offered in 2022 moving forward? And if not, was there anything that you did in 2021 that you made a change for in 2022? So let's go to Jennifer first.
Well, I think keeping masking is just going to continue and feel good, and that's a carryover from 2021 to this year. Certainly the asking for PCR tests, it's unfortunate, it's going to get complicated, it sounds like, but we're going to continue to do that for sure, and keep that. And probably keep our cohorts at least for this year, and just expand those a little bit. So we're gonna, relax it enough that people feel like they get to interact with other folks in a safe manner, but make it as normal of a camp experience with indoor masks as we can, probably. So right now we feel good about it.
Great, let's go to Brandon.
Sorry, the mute button wasn't wanting to unmute. So I did already touch on it some, and we're kind of being the radical here, right? We're saying we're not going to cohort. We're going to count all of camp as a cohort. We are saying that we're not going to require masks. And I hope and pray that in 8 weeks, I'm not saying, oh gosh, we've had the spread of COVID through camp. One thing that we definitely have retained throughout is the right to change our policies at any time to increase. And we've definitely said that if community transmission rates in our areas of Texas go above the low to mild range into moderate, severe, or critical, then we're throwing all these things back in place, the masking, the cohorting, that like all of those things are going to go back into place. But the feedback that we had gotten from camper families was they felt comfortable now and felt like their kids needed some normalcy in their lives. And so we have the medical advisory committee and all, of course, who's setting our policies, but we're also polling our families and finding out what they're comfortable with, and just trying to do the best to meet everything in the middle. One of our medical advisory board members is one of our founders from 1979, one of the first physicians who helped found our organization. And, he says, when we first started in 1979 and we were taking campers on ventilators out in the woods to do stuff, people said we were crazy and it was too risky and there's no way you can do it. And at some point, you just have to decide where does the coin fall in terms of risk versus reward. And, we've been pretty conservative compared to a lot of other camps in Texas in terms of how we've approached things. We've been more radical maybe compared to a lot of other COCA camps. But we've just been trying to walk that line. What is the least restrictive environment that we feel is appropriately safe? So that's kind of where we are on things.
Great, and let's go to Jamie.
Well, we didn't get to run full summer camp last year, so everything as far as summer camp is like, everything is better because we're getting to run summer camp. So we're serving our children. We're excited about that. So we couldn't really pulled things from the teen retreat that we did in the winter into the spring. But Edith put some of that in the chat as far as what we have done is with family camps is start to increase a little bit. We did 20 families last summer and we bumped it up to, or we did 15 families last summer and we bumped it up to 20 this past spring. So starting to get more people to camp and more bodies there. Feeling good about that. The families kind of similar to Brandon, we polled them and their responses to us were just that they're starting to feel more comfortable and wanting to get back to more interaction and not having to be as separated as we were making them be. So that's at least positive that they're feeling comfortable with the things that we're putting in place to get them to camp. So we were pretty heavy with masking, and like Edith said, because we were doing vaccination plus boost for pretty much everybody, they're not going to do masking outdoors, but they will indoors. And then they're keeping that cohort model where we have two cabins of like 6 to 7, Edith, campers that will kind of become a cohort with their counselors. And then one of the cool things that they're doing is that they're going to let that group of 12 pick between 2 activities, so there's still an option of choice. So like they're assigning 2 activities for that pod, and then the 12 can decide which activity they go to for that session, which I think is awesome. Yeah.
That's great, Jamie. That's a really creative way to still give them choice while cohorting. That's awesome. So then Edith actually touched on it in the chat a little bit about enrollment and numbers being a little bit lower than in a traditional summer. So then my next question is, what was your enrollment like so far for the programs you've already offered? Maybe what's your enrollment like for your main summer camp programs? And then what has the reaction / buy-in been from your family? Do you have families that are pushing against your policies? Maybe is your state a little more lax, and because of the population we serve, are you more strict than your state's requirements, and are families pushing against that? So love to hear about just overall reaction from your family. So let's go with Jamie.
I'm sure Edith will. Yep, there it is. So I know she's been receiving some calls from families not being overly pleased, but then there are plenty of families that are very happy with all of the policies that are in place. We did one of the things that we did is because the family camp was no COVID vaccine, we did offer that as an alternative for those families who choose not to. Yeah, but for as far as family camp registration, we were full for 20 camps, 20 families for both weekends. The first weekend was 100% attendance, which hasn't happened in a long time. The second weekend we did have a bunch of cancellations last minute, but it was still 14 families, which was great. So camp still felt full, and everybody was very happy to be back, and just great responses from everybody saying that they're glad to be back and remembering the value of camp. So I think everybody's just ready to be back, and some are a little bit more flexible with what they're willing to do.
Awesome. And Jennifer?
Yeah, so our capacity, we kind of ratcheted our numbers down on purpose, but compared to usual, we're probably at about 2/3 capacity to what we would be full, but reception to coming seems really positive. So families seem happy to be sending kids. Our adult participants are happy to come. I think as we get closer to summer, while we're not feeling a lot of pushback about our masking policy right now, the longer people are used to not wearing masks other places, I wonder if we won't start to see that as July gets here. But right now, people are happy to come, and we are pretty much filling as many beds as we're making available. So, in that regard, we might be 100% full at a more limited capacity of about 2/3 of our usual. We're actually having maybe more concern from volunteers overall on the vaccination front. Dr. Mike asked that question. So I think more of our volunteers would like us to be able to guarantee that everyone will be vaccinated on campus. And we're saying that we can't guarantee that, but that we certainly are highly recommending it. So airfare really is as big of a hurdle for us this year as anything else is.
All right. So, I didn't mention this earlier, and maybe I should have, but this is an appropriate time to mention it as well. We did try to schedule one family weekend retreat this spring that was specifically for families of kids who have cancer plus another disability or condition. It's one that we've done in cooperation with Camp Discovery for many years, and had not done since the pandemic started. They managed the registration for it, so it's a little harder for me to say for sure exactly where the disconnect was, but capacity is has been under our stricter COVID guidelines, 10 families at a time, and only 2 families signed up for it, and we decided to cancel it, and it was free, and so I don't know if it was supposed to be at the end of March, and I know that they didn't get the registration stuff out to families until the beginning of February, or the first or second week of February. So I kind of think it was more a timing issue, that maybe families just didn't have enough time to plan for it. It's hard to say for sure. We are planning to offer it on Labor Day weekend, though, and are hoping to get that word out now about Labor Day weekend, so it will give families a lot more time to plan. For our other sessions, though, family buy-in has been great. We have for most of our families, they've said, we trust you to make the right decisions for what is going to keep our campers safe. You've been doing it for years. We trust you to take all the information and do things the best you can. Our enrollment numbers last summer, we did purposefully operate at about 2/3 capacity. This summer, we have lifted those restrictions. We have not filled all of our sessions yet for summer. We do still have some openings. Some sessions are full, but many others, we do still have some openings. At the same time, my team just reviewed a list of 200 and something campers yesterday and today that are asking to come twice. They want to come to a second session. And because we do still have some openings, then we're looking at allowing that to happen. So we're not finding a problem with getting campers in. It's jumping the gun a little bit to say this, but our issues are more getting the staff and volunteers that we need.
Perfect. Hold that thought, Brandon, because we're going to address Dr. Mike's question first. So Jennifer touched on it a little bit. Dr. Mike had the question of, do you have any pushback of families going the opposite way, where if you are kind of loosening things up from last year, are families hoping that things are stricter? I know in my personal experience, the number of families who want things rolled back far outweigh the number of families who want things to stay the same. But I have had to address quite a number of parents who want things to be stricter. And in my experience, when we're recruiting straight from a child life team, the hospital is directing them that it has to meet a minimum amount of strictness in order for them to even share our program with their patients. So let's go with Jamie. Have you had any pushback of families, quote unquote, going the other way?
I've only had one email from a family that said that they didn't feel ready to come to camp yet. And I think they were still pretty new diagnosis and just still there. Edith might have more for summer camp. She just put it in the chat, but most of the families that I dealt with were all kind of ready to do more, and even some that were, active treatment and, just got off isolation, the week before. So
Great. Jennifer?
Yeah, we haven't experienced a lot of pushback. I don't know how many, of our campers' physicians maybe are saying they'd rather they not travel, but because we are putting out there that we're cohorting and masking and asking for tests ahead of time, people seem like we found a middle ground that seems to make the majority of our families comfortable that we're still taking it seriously and yet also trying to figure out how to get their kids to camp. So right now it feels like a pretty good balance.
We've not had a lot of pushback at all from parents on that end of the spectrum. Even with the family retreats that we've run in March and April, we started giving the option to families during registration if they would like to be paired with one other family for activities instead of being in a strict cohort. And I would say that usually out of about 10 families who attend those, 8 of them want to be paired with other families. They're ready to have more interaction. And so they are self-selecting. We're not making them do it. We're just giving them the option. And about 80% are choosing to, kind of expand their exposure, but to expand their interaction. We've definitely had pushback from a few parents on the other end of things. Some that have been pretty nasty, I'll say, with parents accusing us of abusing or encouraging abusing their children by requiring them to have a COVID test, requiring them to have to put the Q-tip up their nose, that it's equivalent to child abuse, and we should be ashamed of ourselves. Now that's like 3 parents out of over 600, but we do have, again, Texas is very adamant about their personal liberties. Another parent accused us of being the equivalency of racism by requiring that her daughter with disabilities get a COVID test. So some interesting feedback, but again, we're talking maybe 3 out of over 600 families that we've had that.
So is that vocal minority that sticks out, right, Brandon? So Brandon, since you did mention the staffing challenges, let's go to that and you first. So did you have any staffing challenges, whether it came to recruitment, buy-in, difficulty training them under the circumstances? Let's go to you.
Yeah, so going back to summer of 2021, we definitely had difficulty with staff and volunteer recruitment, and we typically hire a seasonal staff of about 70 or 80 who spend the whole summer with us, and then we have volunteer counselors who come for 1 or more weeks of camp at a time. And our numbers were way down last year. Now, we also operated about 2/3 of capacity, and we had what we needed. Had we been running at typical numbers, we would have felt very shorthanded last summer. But because we were running at 2/3 capacity, we had exactly what we needed. For some of us, we feel like that's a God thing, that we're being taken care of somehow. We're in that situation again where we're still actively recruiting staff and volunteers, and probably out of the 70 to 80 that we'd like to hire. We've probably got about 45 hired. So we have most of our cabin staff that we need. We have very few activity staff right now to run our activities. And support staff are pretty hard to find. Because of some of those challenges, we finally decided today that we're going to pull the trigger with a food service company and contract out our food service. It's going to cost about $150,000 more than what was in our food budget for this summer. I mean, food and personnel budgets for staffing. But, you know, when McDonald's can't hire people at $17 an hour and camp cooks are making $14 an hour and working long days, we're like, we've got to do something here. So we are finding that money, and other camps that have done this, many of the Serious Fun camps have done this over the last several years. And they have been telling me for years, try it. Once you do, you're never going to want to go back to having to manage your own kitchen. You know, it's you know, such a time saver on your administration to not have to oversee that. So we will see how that works out. But you know, in terms of training and buy-in of the people who are getting to our gates, no issues. People are happy to do whatever the protocols are that we're saying are going to keep our campers safe. And we haven't had any problems with that. It's really just been getting people to the gates that still concerns us a little bit. Right now, we have about 200 completed volunteer applications for summer. At this point in 2018 and 2019, we probably had 400. So we probably only have about half the number of completed applications. And we have, you know, another 300 or 400 that have started applications and may finish them. And we're certainly reaching out to those people and encouraging them and doing all of that. But it's a different world on staffing in a post-COVID land, or a not post. I mean, we're still in COVID land, but you know, the endemic phase instead of the pandemic phase. Staffing is just a challenge.
Jennifer, we'll go to you next.
Yeah, agreed. We were fortunate last year in the programs we ran. They were a family camp and an adult retreat, so we didn't need nearly the number of staff or volunteers that we would for our full summer season. And so we too got by because we had smaller numbers of participants. But echo what Brandon said, going into our summer season, we are paying more with about 2/3 the length of camp season for people that were paying for the whole season. And I still have 4, I think, of 14 positions available that I don't even have applicants for. It's not like we haven't chosen people. I just don't have, and their activities as well, Brandon, just like you said, we've got cabin folks leading those cabins. And from a volunteer perspective, the usual challenge that we all face of not enough men. We've got more women than we do men who have applied, but we probably have half as many applications. We probably have 2/3 as many people as we would like to have. So with a reduced capacity, we might be okay, but we're still actively recruiting too. I feel like we're going to be actively recruiting once we've started our season even. So, but yeah, it's challenging. And like I mentioned, this is unique to us maybe, but so many of our campers and volunteers fly here. And so from a budgetary standpoint this year, the biggest hurdle we're facing is people needing assistance with travel. So the only thing we typically offer is travel scholarships to pay the full cost of a ticket for a first-time camper. And we usually don't go beyond that for campers, and we usually don't pay anything for volunteers or seasonal staff positions for travel. But we have decided that we have no choice. So for the volunteers who have signed up, most of them are saying there's no way I can come because tickets are like $1,300 a piece to get here. And so we are offering all of our volunteers up to $500 toward their airline ticket, and offering a hardship scholarship to returning campers, which we don't typically do. So I'm not sure where we're going to come up with the extra money either, Brandon. And we almost didn't have a cook because our cook retired, but we got a qualified applicant, perhaps the only one, but we hired him and he starts this week. So we're happy about not having to, worry about the kitchen.
So we are fortunate that we are a partner organization, and we are responsible for cabin counselors and a bunch of activity staff and support and administrative. We are very blessed that our staffing has not been a problem on that end. We have a very dedicated and long-standing group of volunteers who come to camp and are very excited to be back at camp. However, the facility that we use, Camp Twin Lakes, is having that same problem of getting activity staff, getting cooks, getting all of the people to work. So we're helping them as we can and encouraging any young people to go work at camp, but it's a struggle.
Great. So we're going to get to the question portion of the evening. So Brandon did say that the whole camp is a cohort, but I know Gail asked the question of kind of what's your maximum cohort number. So Jamie, what is your maximum number?
For family camps, we're just sticking with the one family, one cohort. For summer camp, we are going to be doing 2 cabins, which is about 15 people total with counselors and campers included.
Great. And Jennifer?
Yeah, we're doing a full cabin, which with our limited capacity this year will be about 14 people too, including campers and volunteers.
Awesome. So there's been some great discussion on Dr. Mike's question in the chat, but what's kind of everyone's plan for if you have a symptomatic camper this year? So Jennifer, we'll go to you first for that.
That's maybe the biggest challenge we face because we can't send people home so easily. So isolation space and, keeping those numbers lower, that if we had to actually test an entire cohort or half of a cohort and keep them housed together for the duration of whatever that time period might be is probably the direction we're leaning. And we're just keeping some spaces open and trying to get by with fewer kitchen volunteers and fewer people in non-cabin roles so that we do have that extra space if we need it. Because if we do have a symptomatic person, we're probably going to have to hang on to them even into the start of another session, which is part of why we built an extra day between. We do multiple sessions back to back. And so we built an extra day into our days between camp. So we're doing 3 days between instead of 2, shortened each session by a day to 6 days, and shortened our season from 8 weeks to 6 weeks. So all of those things we're hoping layered on top of each other will first need us not to isolate, but if we do have space to keep them here. And honestly, we have hotel rooms on reserve. So if some of our summer staff get sick and we need to send them off campus being symptomatic, then we will send them off campus.
Brandon, you answered in the chat, but if you can just kind of elaborate as well.
Sure. I mean, I don't know if there's a lot more to say, but we do have, we feel like we have plenty of space on camp if we do need to isolate. So we're not worried about that in terms of running out of space. We are willing to isolate this year, whereas last year it was just 0 tolerance. You've got anything that might concern us, you got to go. We probably will still do that with volunteer counselors, particularly if they live within a 2-hour drive. We'll probably just send them home. Seasonal staff, we probably will isolate for 24 hours and see if they're ready to return, if it was, short-lived kind of thing. We have the rapid tests on hand, so we will definitely do testing on everybody, period. We had those last summer as well. But, other than that, we're going to be a little more tolerant. Probably if somebody, has some diarrhea, we're probably going to isolate for 24 hours if they're not showing any of the other symptoms that we might see of COVID. So that's our plan.
And for us, similar to Brandon, we do have the ability to send people home, and that's probably where what we did for family camp. We did have a child of a family who started displaying symptoms. The doctor, we isolated them, had the doctor check them out, and then sent them home to go do a COVID test and then report back the results, which were negative. And then that's probably going to be a lot of the same kind of process for a lot of our kids that, we don't want to spread any illness right now at camp. So flu, stomach bugs, all that. So because we're only a week-long camp, the limitation of sending them home is worth it.
And Dr. Mike asked another great question in the chat. I'm about to turn the hosting reins over to him pretty soon. One more question. So this is just for anyone who wants to answer here. What impact did masking and cohorting have on the feel of camp, which is, we all know, a very dramatic change from our traditional programs?
Yeah, Edith just said that it was just good to be back. Honestly, for family camps, it was different, not encouraging the togetherness, which is historically the point of going to family camp. It's getting those families to be around other families that understand. We were able to design that in with distancing in certain ways. So it's really just about designing for your limitations, or your policies. And I think we can program our our sessions to fit what our policies need, but still get the goals that we're trying to accomplish at camp.
I can say that for our summer camp last summer, where we were stricter on the cohorting and all, for the most part, very similar. People were just happy to be there. They had been locked in their houses for a year and were just happy to be there. They were willing to go along with whatever needed to happen. You heard from a few staff, gosh, camp just feels different. Like, I'm glad I'm here, but it just feels different. So you heard that from, I don't think I ever heard that from any camper. They were just like, oh my God, I'm so glad we're at camp again. The hardest part logistically, for most of our daytime activities, we tend to schedule things so back to back anyway that people are they keep moving and don't notice. It was really probably some of the evening activities that typically have been all camp activities that we did differently last summer to keep the cohort smaller, that may have felt some different. Just in those evening activities, daytime felt pretty much the same for the most part. But again, I think so much of it has to do with the attitude that your staff present things in. And if it's like, man, I sure wish camp could be like it used to be, but we'll make the most of it. Well, you're gonna get a different response from oh my gosh, it's so great that we're at camp, and guess what we get to do this year? It's really all about the reframe. I'm a behavioral psychologist, right? So I always think about that. It's how you spin it. But yeah, I think that everybody, when you approach with the right attitude, everybody's just happy to be engaged and at camp.
I'd say I saw a big difference in people's reception to things between last fall when we did a women's retreat. We had a couple of women that we were really keeping strict eye on people wearing their masks and staying in their cohorts, which last fall were very small. Those cohorts were 3 or 4 people. And so I think there was some resistance to not being able to sit with anyone, not being able to interact with anyone last fall. And people did it. They were happy to be there and they masked, but it was harder for them to comply last fall. And this spring, when we did a retreat already, it was fine. Everyone's used to changes. Everyone's used to doing whatever they have to do to be where they want to be. People were thrilled. And yeah, so I'm seeing a lot less resistance to any of that for this spring than last fall when it was stricter and we had smaller groups. So expanding those cohorts to a whole cabin this year and doubling that number of people they can be with, I think is going to help a lot. And letting them interact with other cohorts with masks, I think is also going to make people happy.
So we are at the end of our time here, but just did anybody have any last minute questions or comments that they really wanted answered before we break?
Just thank you and good to see you all.
Good to see you. We're excited to have you with us this summer, Dr. Mike.
I'm looking forward to it.
It'll be awesome. Good luck to everybody with your season, whatever it looks like.
Yes, definitely.
Absolutely.
Yeah, thank you,
And always happy if there's anything that I can share. If people want copies of policies or anything, I just pop my email address in the chat. Anything that's ours is public domain as far as we're concerned. No secret sauce.
It's
Yeah,
good to see you
us too.
guys.